Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and today I wanted to talk to you about the different types of tests and the way that we decide on what kind of disc problem that you might have. So in the previous video I talked about the two types of disc problems, the ones where there's a disc bulge compressing the nerve and the one that is just a localized problem due to degeneration. It's very important that we determine what kind of disc problem that you have, and a few of the key tests, probably there's top 3 or 4 different tests or examinations that we do to determine which it is. And one of the first things we'll do is we'll do some palpation. We'll actually get in there and feel the vertebrae in your spine and feel whether they're moving normally or not. The second thing we'll do is do some very important neurological tests. You see, when we have a disc bulge that's compressing on the nerve, that nerve will stop working properly. And so we can do a few different neurological tests to determine, is the nerve being compressed or not? One of the tests we may do is some muscle tests, where we'll test the different muscles, whether they're in the leg and the feet, or in the arm and the hands, to determine if one of the nerves is being compressed and there's no longer a normal nerve supply going to that muscle. And if that happens, then the muscle just won't work as well, it won't be as strong. And so we can test that, and it gives us a lot of information about what level of the spine may be compressing the nerves in your body. The other test we can do is some sensory tests to the nerves. So we can use a little prick, and we can go along and prick the skin, and you can tell me whether there's areas of numbness or lack of sensation in the skin. And that often tells us that, again, the nerve may have been compressed for some time and you're starting to lose the ability to sense pain in that part of the body, whether, again, when it's the hand or whether it may be the feet. The other tests that we may perform, of course, or not really tests, but we take a thorough history. We want to find out where the symptoms are, where are you feeling them, how they started, how often you feel them, whether they're morning or evening, whether they're when you're sitting or standing, what sort of posture you might be in when you feel the pain and discomfort associated with what is possibly a disc injury. And of course, your old history, accidents that you may have had in the past, traumas that you may have had in the past, a history of back pain in the past, those kind of things we're also extremely interested in. And then lastly, we might perform some other diagnostic tests like CT scans of the spine or even an MRI, which gives us beautiful pictures of not only just the vertebra but the soft tissue, the discs in between, and can often help us decide whether there is a disc bulge and how best to treat it. So I hope that gives you a bit of a kind of bird's eye view of the different tests that a chiropractor may perform on you to help determine what kind of disc problem that you have. Remember, look after your spine. I'm Dr. Ben from Mornington Peninsula Chiropractic Centre.